Good morning, everyone. My name is Briana McNamee, and I'm the Director of Governmental Affairs with the New York State Dental Association. Joining me today are three of the New York State Dental Association's leaders. We have Dr. Prabha Krishnan, President, Dr. Maurice Edwards, President-Elect, and Dr. Amarilis Jacobo, Vice President. Over the course of the next 20 minutes, we will be sharing an overview of the New York State Dental Association's legislative priorities for 2025. In the coming months, we will have dentists, dental students, and other members of the oral healthcare profession coming to the Capitol to speak to you in further detail about the bills, regulations, and other fiscal requests we have, each with the goal of building a healthier future for all of New York. Each of our speakers will provide details on one priority area. Afterwards, we will have time for a brief Q&A. Without further ado, Madam President. Go ahead, Dr. Krishnan.
Hello, I'm Dr. Prabha Krishnan, President of the New York State Dental Association, and I want to thank you for allowing me the opportunity to address you today. As representatives of the dental profession, my colleagues and I are deeply committed to the health and well-being of our communities. We take pride in serving the diverse and vibrant populations across our great state, helping to prevent disease, alleviate pain, and improve the overall quality of life of all New Yorkers. However, we are currently facing a growing challenge, a workforce shortage that is putting pressure on patient care, access to services, and the long-term viability of our profession. The dental profession is experiencing a critical shortage of practitioners, one that is having far-reaching impacts, especially in the underserved and rural areas. These shortages are not just an inconvenience for patients, but have become a public health concern. Many communities across New York are experiencing long wait times for dental appointments, and some regions simply cannot recruit enough dentists to meet the demand. At the heart of this workforce shortage lies a significant barrier to entry: the high cost of dental education. The price of tuition and the weight of student loan debt are some of the biggest obstacles facing aspiring dental professionals today. As a result, few students are pursuing their dreams of becoming dentists, and many existing practitioners are leaving the field. If we are going to address this workforce shortage and meet the growing needs of our communities, we must make dental education more accessible. There are several ways you can make a significant impact. Loan forgiveness programs. Supporting or expanding existing loan forgiveness programs will encourage dental students and those interested in oral health to practice in underserved areas where the need for care is greatest. These programs can also help with retention by making it financially feasible for dentists and their staff to stay in practice longer, especially in rural and low-income communities. Scholarships and grants. Targeted scholarships and grants for dental students, especially those committed to serving in high-need areas, can reduce the financial barriers to entering the profession. This will not only increase the number of dental professionals, but also ensure that care is accessible to everyone, regardless of their geographic or economic situation. increase funding for dental schools. Providing funding to dental schools can help lower tuition costs, make education more affordable, and increase the capacity of these schools to train more students. This will allow us to meet the increasing demand for dental care by ensuring we have a steady stream of qualified professionals entering the field. While the financial barriers are evident, the workforce shortage extends beyond education costs. Dentists, hygienists, and assistants alike are facing burnout, high stress, and the challenge of maintaining sustainable careers in an increasingly demanding profession. With long hours, overwhelming patient loads, and the pressure of administrative work, many in the field are struggling to keep pace, which not only impacts their well being, but also the accessibility and quality of care for patients. We need your leadership in promoting solutions that will help build and maintain a robust dental workforce that is always equipped to serve the diverse and growing needs of our state. Provider support. Programs focused on improving work-life balance, offering mental health support, and providing opportunities for career growth and development are essential in keeping professionals engaged and in the field. Continuing education opportunities also play a key role, not only in ensuring that dental professionals stay current with advancements in the field, but also in giving them a sense of progression and fulfillment in their careers. Lastly, dentists and their teams must be empowered to work to their full scope of practice by supporting legislation that allows dentists and their hygienists and assistants to practice to the full extent of their education and training. We can improve efficiency, expand access to care, and ensure better outcomes for patients across the state. We are eager to collaborate with you on solutions that can improve the sustainability of the profession, address workforce shortages, and ensure that every New Yorker has access to the dental care they need. I will now have my colleague, President-Elect Dr. Maurice Edwards, speak to you about dental insurance reform.
I'm Dr. Maurice Edwards, President-Elect of the New York State Dental Association. I would like to thank both the state legislators and NYSDA members for joining today's call. We can make a meaningful difference by working in partnership. While dental insurance may not be a topic that gets the most news coverage, it is among the most important issues to our members and their patients. As Dr. Krishnan noted, our profession, like many in healthcare, is facing a workforce shortage. Without meaningful insurance reform, the state dentists are at risk of not being properly reimbursed for their services, which in turn can lead to less dentists, decreased access to care, and ultimately higher consumer prices. Insurance is meant to provide access to important necessary care regardless of income or background, making sure everyone is able to get the treatment that they need to succeed. We know good oral health is the gateway to good overall health. I think I speak for all the dentists on this call when I say we entered this profession in order to change people's lives for the better. We are proud to represent the state of New York, which has always led the way when it comes to promoting meaningful change that creates a more equitable society. So much can be done on the state level to make sure our communities receive the care they need and deserve. NYSDA has never backed down from the challenge, and we know our state lawmakers are eager to help find a solution. Just recently, I was reminded about how difficult the insurance process can be When hearing many veterans, how many veterans of the New York State Dental Foundation was able to reach last year through its Salute Vets with a Smile program. Veterans who typically are not offered dental insurance through the VA can use the foundation's services to receive free, life-changing care. Many of these veterans had not been to the dentist in decades. So far, 107 veterans have received care, including extractions and cleanings, by the 56 dentists that have volunteered their time and resources. These veterans risked their lives for our country and should never have been put in this position to begin with. Unfortunately, this is just a small sample of individuals statewide who are suffering the effects of poor insurance policies. Every year, our dentists participate in free dental clinics where people without insurance coverage come in desperately needing care. This should not be the norm in the state of New York. Our neighbors should not have to decide between receiving necessary oral health care and putting food on the table. At the same time, dentists should be properly reimbursed for their craft and dedication without fear that the claims will be rejected or large insurance companies will unfairly benefit financially from their services. Over the coming months, we will be speaking to you about the various proposals aimed at improving dental insurance. These include setting up a dental loss ratio, similar to the one established in the Affordable Care Act in 2010, addressing business practices like network leasing and virtual credit card use, and even ensuring transparency in insurance contract details, because as we all know, it's often in the fine print. We must create a holistic approach to dental insurance, further allowing the profession to grow in order to provide the best possible care for all New Yorkers. These measures, along with others, will provide for a better, healthier future. Insurance reform is complicated, but we are up to the challenge. We know there are better solutions to provide crucial care at affordable prices for both patients and healthcare providers. It's our duty to act. And with that, I would like to throw things over to my colleague, Dr. Amarilis Jacobo, to speak about addressing the access to care.
Good morning. My name is Dr. Amarilis Jacobo. I am the Vice President of New York State Dental Association. It is an honor to represent our state dedicated dental professionals who are deeply committed to improve the oral health and well-being of our communities. As you heard from both of my colleagues, Dr. Krishnan and Dr. Edwards, it is vital we expand the workforce and make meaningful insurance reform in order to provide affordable, quality care to our patients, our constituents, and everyone in the great state. Today, I want to discuss the fundamental issues that directly impact the health of all New Yorkers: access to dental care. As we continue to face ongoing health challenges across our state, it is critical that we recognize oral health as a right, not a privilege. Every individual, regardless of their background or financial situation, deserve access to the care they need to maintain their oral health, whether that is an elementary school student in Rochester or a retired EMS worker in Malone. Oral health is not just about having a bright smile. It is essential to overall health. In fact, research has consistently shown that poor oral health is linked to a range of serious health issues, including heart disease, diabetes, and respiratory conditions. This makes it more important than ever that we ensure access to dental care for everyone at every stage of their life. Unfortunately, right now, many individuals across New York lack this access, which results in unnecessary pain, suffering, and even preventable health conditions. We are particularly concerned about underserved populations who face significant barriers to care: youth, seniors, individuals with special needs, and those in rural or low-income areas are disproportionately affected by limited access to dental services. They are the ones who often fall through the cracks, unable to receive timely treatment or preventive care. Let me start with the youth, a population that will carry the consequences of today's decision into the future. Many children in underserved communities face barriers such as lack of insurance, lack of transportation, and limited access to dental providers. Without access to early and preventive care, these children are the higher risk for cavities, gum disease, and other dental issues that can impact their academic performance and overall quality of life. By ensuring that all children have access to dental care, we set them up to a healthier, more successful futures. Now, consider our seniors. As people age, they often face unique oral health challenges, including gum disease, tooth loss, and dry mouth, which can severely affect their ability to eat, speak, and maintain proper nutrition. Seniors are more likely to face financial barriers to dental care, and for many, the lack of Medicare dental coverage creates a significant gap in their access to services. Addressing this gap is essential to improving the oral health and quality of life for our older population. We must also focus on individuals with special needs, a group that often requires specialized care. Individuals with special needs, whether physical, developmental, or intellectual, often experience higher rates of oral disease but face significant barriers to care. These barriers may include limited ability to specialized dental services providers, as well as physical or communication challenges that can make dental visits more difficult. It is essential that we ensure these individuals have access to providers who are trained to meet their unique needs, and dental offices are equipped with the tools to provide an extension environment. For rural or low-income populations, access to care is a constant struggle. In many rural areas, dental professionals are few and far between. Long distances, lack of transportation, and financial barriers make it difficult for people to receive the care they need. In urban areas, low-income families may face similar barriers, with many unable to afford private dental insurance or out-of-pocket costs. By expanding access to care in these communities, we can reduce the health disparities and ensure that all New Yorkers, regardless of where they live or their financial status, have access to dental services they need. At all stages of life, access to dental care is critical. So what can we do together? How can we work to ensure that every New Yorker has access to dental care they deserve? First, we must expand access to dental coverage, especially for underserved populations, ensuring that dental care is integrated to public health programs like Medicaid, and expanding access to dental insurance can help close the gaps in care. Additionally, we need to support mobile and community-based dental programs that bring care directly to the communities that need it most, including school, senior centers, and rural areas. Second, we must ensure that dental professionals are equipped and empowered to serve diverse populations, including youth, seniors, and individuals with special needs. This means supporting education and training for dental providers in cultural competence and special care techniques, ensuring that they are prepared to meet the needs of all patients, regardless of age, ability, or background. Last, we must focus on preventive and early intervention. By investing in preventive care, especially for children, we can reduce the need for more expensive and extensive treatments down the road. Early education about proper oral hygiene, coupled with access to regular checkups, will lead to healthier individuals and lower overall health care costs. Oral health is a right. Together, we have the opportunity to build a healthier future for all New Yorkers by ensuring that everyone, regardless of their background or circumstances, have access to the care they need to maintain optimal oral health. We can work together to break down the barriers that prevent many from accessing care and ensure that oral health is prioritized at every stage of life. I will now ask our Director of Governmental Affairs to wrap up our morning section. Bree?
Thank you. I hope after hearing from Dr. Krishnan, Dr. Edwards, and Dr. Jacobo, it is clear we must address oral health holistically. It is only by addressing the educational pipeline, insurance reform, and everything we've discussed today that we can hope to really and truly expand access to care. One does not work without the other. We do have a few minutes to take questions. If you would like, you may submit any that you have using the Q&A function at the base of your screen. I'll now give everyone a few seconds and we'll move on if we have those questions. All right, I do see several. Let's start with the first, which is to any of our panelists, perhaps Dr. Krishnan. How do you see the role of dental professionals evolving in the next decade?
So, oral health is the key for overall health. We, as a team, all the stakeholders need to work together so that we can make this happen in terms of providing services, in terms of providing community services, loan reimbursements, programs, or other opportunities where we can have enough dentists in areas where there is access to care issues. We have a lot of dentists, but it's really a maldistribution of dentists. So helping the schools, helping community services fund with their funding, and providing loan reimbursement programs will definitely help with this in the future. So we all need to work together as a team, also understanding that there's definitely some burnout, and this also needs to be addressed. So it's always teamwork that can make it happen to provide equal quality care for all New Yorkers.
Excellent. Thank you, Dr. Krishnan. I do see several more. I'm just going to pick at random here. So the next question here is, how can we encourage more people, especially young individuals maybe that are in middle school or high school right now, to consider dentistry as a viable and rewarding career? Maybe Amarilis, would you like to address that?
Or I could take it if you want.
Sure, 8-1.
So as Dr. Krishnan alluded, it is going to take a holistic approach for us to tackle this problem. It's a twofold. To get more younger people started in the field, as well as to address the dental deserts that we have in different states where we don't have the number of dentists to the need that is in that area. One of the things we can do, besides taking a holistic approach of just trying to get more people involved in dentistry, is what I'm currently working on with our national association. I'm working with Dr. Brett Kessler and Dr. Rich Rosado, the president and president-elect of the ADA. And what we're setting up is a program in the schools of Chicago, where we're going to set up a program where we go to elementary schools as well as high schools and introduce them to the field of dentistry at an earlier age, so that hopefully we can gather some interest in dentistry as a whole for that group of people, because it is actually that group of people who represent the underserved. They live in those underserved communities. And if they become dentists and they go back to their communities where they've been raised, it'll actually decrease those dental deserts that we're talking about. So, one of the things that we can do is set up programs that will allow easier and earlier access for younger kids, whether it's elementary, middle school, high school, where they're actually exposed to dentistry and know that is a viable option.
Awesome. Thank you, Dr. Edwards. So I do see, I think we have about 14 or 15 other questions and not enough time. So certainly as we see them come in, we will keep them and answer them offline. The last that I want to make sure that I address is there is a question about when these events or when these advocacy events are going to happen, when we're going to be in the Capitol. So there will be 3 separate events, times that you're going to be seeing us all down at the Capitol and LOB. The first is going to be March 20th. So we're still going to be within that budget season. We are going to be speaking about proposals about workforce that day. The second is going to be April 30th, and we are going to be speaking about dental insurance reform. So going into the nitty-gritty that Dr. Edwards went over. And then the third and final in-person event will be May 14th, and we are going to be speaking about access to care in a myriad of ways. So going further into those details that Dr. Jacobo spoke about. So with that, being cognizant of everyone's time and that you will likely need a second or third cup of coffee right now, it is 8:29. I want to thank everyone for joining us this morning. And I think I speak for all of us that we look forward to advocating on behalf of the profession in the coming months. Thank you, everyone.
Thank you.
Good morning and have a good day, everyone.
Goodbye.